Welcome back to the show. In today's marketplace, erasing unsightly varicose veins. New procedures are making it easier than ever to get rid of these dreaded and unwelcome conditions. Dr. Sam Gupta from Vein Clinic PA is here to show us some amazing before and after photos. I just was talking to Dr. Sam off camera and said, do you have to be put under? And you used to hear of just stripping those veins when people had these problems, and you say not even the case anymore.
Heidi, those days are over. It's a thing of the past. Of course, for over 100 years, that's all we had. If you had vein problems, you would be admitted to the hospital. You would be given general anesthesia, and those problem veins would be taken out.
But a big procedure, yeah.
Big procedure, and so you expose yourself to the pain, the downtime, complications, and even worse, over 50% of these patients had these veins regrow, and they would be back with symptoms. Over 50% of the patients I have in my practice have already had vein stripping and other treatments in the past.
And they're back.
And they're back.
Okay, so today's procedure, you come in, what happens?
We ask them to pick a good magazine. We give them a sucker.
A sucker, well, that's nice of you.
And they lie down, and we have a unique four-step numbing method. I mean, of course, it's still a procedure,
yeah.
But they certainly don't have to take any time off from work. We thread a tiny laser fiber right to the source of the problem veins, and the laser energy shuts the vein down from inside.
And is it painful?
Once we have gently numbed the area, they don't feel anything. They're reading a magazine, or they can watch the entire procedure on a monitor.
So how do you know that it's time to do this? We're seeing a male doing this as well. It's not just for cosmetic reasons. How do people know that it is time to get this done?
Well, you touched a very important point. For some reason, there is a misconception that vein problems, including varicose veins, affect women only, or primarily women. Mm-hmm. Some studies were done that demonstrated there are more men who have vein problems than women. Now, women will present with symptoms much earlier, partly because some risk factors such as pregnancies and hormones, and because women tend to seek help much sooner. Men, on the other hand, will avoid seeing their physician for a long time, and hence, by the time they present to us with vein problems, the condition is far more advanced.
So it isn't just to do it for cosmetic reasons. It can hurt, and it can cause problems for people, correct?
Very true, because the misconception that this is a cosmetic procedure probably comes from the fact that people can see these veins. Mm-hmm. Now, for every person who comes to us with symptomatic varicose veins that are visible, I could probably show you somebody who has no visible veins and has the same symptoms. So really the problem is way deep below the skin surface.
Okay, so now we're going to look at some before and afters, which are really amazing to see when people come in and what they look like afterward. Take a look at that. That's an amazing difference. How long did it take for the after to come about?
The symptom relief is almost as early as minutes after the procedure.
Wow.
Now, we start by taking care of the source and then go after all the remaining disease branches of the disease network until bulk of those veins have been taken care of.
Now, here are we looking more at spider veins versus varicose veins?
The ones that you see here are spider veins.
And what can you do for people who have that, who don't have such a severe condition? Probably easier to take care of.
If this person has symptoms, which very likely this person has, because after all, spider veins are terminal branches of varicose veins. Mm-hmm. Varicose veins and spider veins are all branches of the same tree. If this person has symptoms, we would want to go and take care of the source or the bigger varicose veins beneath the skin surface first. A lot of times, a lot of these spider veins will start to disappear just from that. But if these spider veins persist, the gold standard has always been injection sclerotherapy, mm-hmm. where we would first get a detailed view with a special light, look at the spider veins in detail, and then inject medication which makes these veins disappear.
It makes them go away.
Now, over several years, the tiniest spider veins and veins that were very curvy and twisty were a challenge to treat.
Yes.
Because you couldn't get even the tiniest needle into them. Now we have a technique, an instrument called Vein Go. What it does, it allows us to have a hair-thin probe that we can place right over the spider vein, and it delivers a thermal energy beam that shuts the vein down.
That is fascinating. We are actually out of time, but I do want people to know that you offer free consultations. It's covered by insurance. These are all things that you can check out, so I'm going to give everybody the information. Thank you so much, Dr. Sam, for coming in and giving us all of this important information. Vein Clinic PA has 4 locations. They are in Blaine, Lakeville, Hutchinson, and Chanhassen. For more information or to set up a free consultation, as I mentioned, just call 800-955-VEIN or visit veinclinicpa.com.